We have an 8-month-old child presents with a history of poor growth and chronic cough. He was born to a 21-year-old woman at 41 weeks of gestation. Soon after birth, he developed respiratory distress and was admitted to the NICU, which is your neonatal intensive care unit, where he received mechanical ventilation for 24 hours. He was initially breastfed, but because of frequent vomiting and loose bowel movements, he was formula fed thereafter. Despite this change, he continued to have loose, large, greasy, foul-smelling stools and failure to thrive. On physical examination, his temperature is 37, heart rate is 120, BP is 80/60, O2 is 97 on room air, and the baby's weight is around 6.7 kg, which is less than the 5th centile. HEENT examination is significant for bilateral otitis media and mild nasal congestion. Normal breath sounds with mild wheezing and rales are heard. What do you think is the pathophysiology in the behind the patient's bowel habits? Is it metaplasia, hyperplasia, dysplasia, hypertrophy, or do you think it's atrophy? Okay, this was a general path question. So here the patient has cystic fibrosis. It's an autosomal recessive disorder due to mutations in the CFTR gene. These mutations lead to what? Defective chloride ion exchange with alteration in chloride, water, and salt transport, which results in thick sputum, thick, very sticky mucus production that cannot be cleared. So it will clog in your secretory ducts. It need not be just respiratory, it can also be in pancreatic, bronchioles, and seminiferous tubules. As the secretion becomes thicker and thicker, the ductal lumen keeps getting blocked. It increases the back pressure. That decreases the production of enzymatic secretions and results in disuse atrophy of the gland. Now, malnutrition and fat-soluble vitamin deficiencies result if the pancreatic exocrine glands are also involved. Atrophy is defined as a decrease in size and weight of the tissue, the organ. It can be because of so many causes. These are the different theories that's been given, either because of decreased hormonal stimulation, example is your ovaries post-menopause, or use of a lot of exogenous thyroid hormones that will result in atrophy of thyroid gland, or decreased innervation, nerve condition like lower motor neuron lesion, which eventually leads to muscle atrophy, decreased blood flow, decreased nutrients, increased luminal pressure. That's seen in cystic fibrosis. Thick pancreatic duct secretions in cystic fibrosis occlude the lumen. They'll increase luminal blood pressure, leads to atrophy. Atrophy of the gland causes what? Malabsorption. So you'll have fatty stools, frothy, heavy stools, smelly stools. Okay, and all the pancreas is damaged, leading to type 1 diabetes. Atrophy can be due to the loss of cells by apoptosis. It is characterized by what? Decreased protein synthesis and increased protein degradation. Decreased protein synthesis often occurs in catabolic conditions like muscle wasting or lower motor neuron injury. Increased degradation is handled by ubiquitin proteasome pathway. So these are all general pathology, and you should know this at the tip of your fingers. Metaplasia is what? Replacement of one type of cell by another type. It could be because of irritation seen in Barrett's or environmental exposure seen in smoking-induced metaplasia of your ciliated pseudostratified columnar bronchial epithelium into squamous metaplasia. And hyperplasia is increase in the number of cells, and you can endometrial hyperplasia seen because of unopposed estrogen action, which can further lead to carcinoma as one of the examples. Prostate hyperplasia is one mode, which is hormone related hyperplasia. Dysplasia is atypical hyperplasia characterized by abnormal growth. It is mostly like before cancer kind of a condition, like your orientation changes, shape and size change, your NC ratio changes. It's a precursor to cancer. Dysplastic cells are seen in HPV patients, where you see disorganized squamous epithelium, and large nuclei are seen, which are present near the surface of the epithelium, and then slowly they start infiltrating downwards. Okay. Hypertrophy is size is increased, not the number. Concentric and eccentric hypertrophy, which you see in the heart, right? Because of pressure overload or volume overload. Those are the examples of hypertrophy. So what is the takeaway from this question is, you should learn what atrophy is, what happens in atrophy, and what are the different theories where atrophy is caused. That's one thing. Other than that, you should remember about the mechanism here, like this is the one: decreased protein synthesis and or increased degradation, decreased production, increased degradation. That's what you remember. Where is there a decrease? One example they have given is muscle wasting, and degradation is handled by the ubiquitin proteasome pathway. These are the few examples has been mentioned.
Thanks for watching. Please give a thumbs up and subscribe for more.